Emotional symptoms, sadness. Sadness. This includes a sad emotional state with frequent crying. Sadness which pertains to lungs must be distinguished from a lack of joy, which pertains to heart. Sadness is an emotional state that weakens the lungs and usually manifests with lung-related symptoms such as a pale complexion and a weepy and weak voice. Lack of joy, on the other hand, is not an actual emotional state but a certain lack of vitality deriving from heart deficiency. This manifests not with a sad demeanor but with a flatness and lack of fire. A patient may report a feeling of sadness or may be unaware of it. A full or empty quality on the lungs pulse is usually the most reliable indication of whether sadness is involved in a presenting condition. So, authors find that a full lungs pulse often indicates sadness which has been held on to for a long time by the patient, who may be totally unaware of its presence. When the lung pulse is weak or empty, the author find the patient more likely to report feeling sad. Sadness depletes lung and heart qi. However, with time, the deficiency of qi in the chest also may give rise to some stagnation of qi in the chest. This stagnation is associated with the lungs and heart and not the liver. It manifests with a slight feeling of tightness of the chest, experiencing the sadness in the chest, sighing, and slight palpitations. The most likely empty patterns giving rise to sadness are a deficiency of lung qi or liver and or heart blood. When the sadness is due to an empty condition, it is often accompanied by frequent crying. Sadness from liver blood deficiency and more common in women and become worse after a period or after childbirth. Sadness with a feeling of lump in the throat may be due to lung qi stagnation. Grief is akin to sadness and usually derived from loss, separation, or bereavement. Like sadness, it depletes lung and heart qi. But with the time, it also may give rise to some stagnation of qi in the chest, causing symptoms similar to the ones mentioned above for sadness. Our summary: sadness, lung and heart qi deficiency. So there is sadness, crying, depression, pale tongue, empty pulse. Liver blood deficiency, sadness, crying, mental confusion, aimlessness, pale tongue, choppy or fine pulse. Heart blood deficiency, sadness, crying, depression, pale in tongue, choppy and fine pulse. Lung qi stagnation, sadness, mild irritability, depression, tongue slightly red on the side in the chest area, pulse very slightly tight on the right front position. Lung and heart qi deficiency, sadness, crying, depression, dislike of speaking, palpitation, shortness of breath on exertion, pale face, tiredness, weak voice, spontaneous daytime sweating, bright white complexion, propensity to catching cold, dislike of cold, pale tongue, empty pulse. Acupuncture, lung 9, stomach 36, ran 12, lung 7, lung 3, heart 7, and do 24. Heart blood deficiency. So there is sadness, crying, depression, insomnia, dream disturbed sleep, anxiety, propensity to be startled, poor memory, palpitation, dizziness, dull pale complexion, pale lips, and tin tongue, choppy or fine pulse. So acupuncture, heart 7, rent 14, stomach 36, spleen 6, and do 24. Liver blood deficiency. There is sadness, crying, mental confusion, aimlessness, poor memory, dizziness, blurred vision, floaters, numbness or tingling of limbs, scanty menstruation, dull, pale complexion, pale tongue, choppy or fine pulse. This pattern is more common in women and due to sadness affecting the liver. Acupuncture, liver 8, stomach 36, spleen 6, rent 4, heart 7, and do 27. Ay, 24. Lung Qi stagnation. Sadness, mild irritability, depression, feeling of lumps in the throat, difficulty in swallowing, feeling of oppression or distension of the chest, slight breathlessness, sighing, tongue slightly red on the side in the chest area, pulse very slightly tight on the right front position. Thank you for your attention.